constantly pulling her into this tug-of-war match. Winner, loser. So, Hello, it is July 4th week this week. We want to have a case today about a veteran. We are so thankful that our veterans have fought for so long to keep our independence. So this is a fitting case. She has had back pain for over 30 years. She came to us and said, I really don't think you can help me, but give it a shot. I've been everywhere else. So I'm gonna actually teach you something today that might help you with your low back pain, even if you've been everywhere else, so stick around. So like I said, we've got a 50-year-old lady. She has struggled with low back pain for at least the second half of her life. That's a long time. She's been everywhere, tried everything. Physical therapy, the VA hospital constantly, medication, bracing, and especially at-home stretches. Okay, that was interesting to me, and you're gonna find it interesting. I asked her to do a couple of different movements to tell me what's going on with her low back. I had her bend forward first, like she was touching her toes. She went past her toes, palms flat, knees straight. She's good there. She said, I stretch that constantly because it feels like where I need to loosen it up. I said, try bending backwards. When she bent backwards, she kind of had this groan on her face. She wasn't very good at it, not near as good as the other way. That was kind of a key in showing me what I found. You probably, because we see it so often in our office, have it or know somebody that does, tight hip flexors. Okay, let me show you. I've got this weird band around my belt to show you. I'm gonna attach it to my foot because anything along the front side of the hip, belly, thigh, lower leg could be what's pulling you like I am right now and like she was. So you can see my belt is down. My pelvis is tilted forward. There's this deep curve in my low back. Think about this as our bully and this as our victim. This lady had been stretching her victim forever and nobody had found her bully, okay? So I commenced to doing that really picky soft tissue work that we do. We found these adhesions along that hip flexor line, didn't touch her low back. 4 visits or so in, she comes to me and says, Doc, I'm 70% better. Something super substantial. She said, I can't believe it. That point, I commenced to working on what I would call the victim, loosening up that scar tissue that had formed from that long-term problem. She came to me just this week and said, Doc, I don't need you anymore. I can't believe it. I never thought you could help, but I don't need you anymore. This is probably one of the most commonly seen problems for low back pain and overlooked problems for low back pain. She's feeling great. We're so happy to help. So 2 things we can learn from this video. Number 1, your victim does not always need to be stretched. The location of your pain is not always the source of your problem. You may need a professional to get in there and find that bully for you and just refocus you on what can help you. Number 2, don't give up. This lady has had this problem for over 30 years, like I said. She's pretty much quit counting. Pain is not normal. You shouldn't just accept, oh, I'm just gonna have this pain. If you keep having pain, you're wearing out your spine and you only get one of those. Now, if you like this video, please click the thumb. If you know somebody that needs this, please share it on your timeline. They might see it. Share it on their timeline. If you have a question or just a comment that you'd like to share, please leave it below in the comment section. Thank you again to our veterans. This has been Dr. Ryan House with Cumberland Chiropractic and Sports Medicine, where we get you better faster.